Hi, I'm Cherian Varghese. I currently work as the director of the Prasanna School of Public Health at Manipal Academy of Higher Education. Before joining here, I was with the World Health Organization for about 2 decades, and I had the good fortune to be part of the initiation of the Global Initiative for Childhood Cancer when I was in Geneva and in planning the program at a global level at that stage. So I'm very keen to be part of this meeting and to engage with all the delegates who are here to look at the progress in India in childhood cancer. I think integrating cure and care is critical in all diseases, most important in childhood cancers, because this is a condition where a child has to go through a very difficult phase, the family has to go through a very difficult phase. While India has excellent clinicians who can actually manage cancers, it has to be balanced with an equal amount of care and support, because it is a very prolonged, to some extent, with agony that the families are going through. So care has to be integrated from day zero, not even from day one. At the thought of the disease itself or the initial suspicion of the disease itself, the family should be supported, and the care has to extend in multiple ways depending on the family's needs, whether it is financial, psychosocial, education support, looking after the family, various aspects. So it has to be a 360-degree approach to make any difference, and that is why I think CanKids and all these NGOs are doing tremendous work. In fact, I know Poonam Bagai of CanKids for the last so many years when I was with WHO, so I could see that this has really made a difference, and it is good that there should be a more closer engagement between government entities and civil society, because a routine government system has a lot of limitations, and when a civil society entity comes, that limitation gets overcome. So I think my main suggestion and the plea is for more of seamless care, I think, between private and public health facilities, between these facilities and the civil society and the people who are affected, because then only we can make the maximum benefit and impact out of the effort that we put in. We should certainly, and there are some good examples with the shared care approach, with the hub and spoke approach and all that, but we should do more of that. India is very well pleased for such a thing, because we have already a reasonably good health system with different levels, so that even after treatment, if you equip the primary health care, then they could go and do survivorship at that level. Palliative care, I think pediatric palliative care has gained importance, which we need more work on that, because it has got huge implications for the family with psychological issues and all that. So more and more people need to work on pediatric palliative care, not only with childhood cancer, which are other conditions also has to be factored into. So India can certainly look at, the numbers are small, unlike TB or other cancers, so we'll have to sort of customize to each district. So there is no one size fit all districts. A district in southern Karnataka will be very different from a district in northeastern one of the states. So and the stakeholders also will be very different. The cultural factors will be different. So if we can customize, that can be a very good model to start with. Cancer as such is one of the major reasons for very high out-of-pocket expenditure. Within that, certainly childhood cancer also leads to very high out-of-pocket expenditure with high financial toxicity. So I think policies have to be thought through with certain standard protection mechanisms. That is what the universal health coverage, India's programs like the Ayushman Bharat program actually provides that support, which is very good, which was not there. But it has to be again further tailored, because it is one size fit will not fit everyone. So for a childhood cancer survivor, maybe it is a much prolonged support that is needed. So when public policy is being made or financial policies are being made, all these aspects have to be looked into. So survivors have to be called in, parents have to be called in, so that one can really understand what is the trajectory of the family, and then have appropriate protection mechanisms for all these domains. Childhood cancer is relatively rare, but there are facilities which offer very good cure or very good care also. But often it is very difficult for somebody in a rural area to reach this place. So unless there is a collaboration between the treating tertiary hospital, society and NGOs, this sort of care pathway does not work out. So there has to be some sort of navigators, some sort of people who are supporting, and then institutions like MAHE can also do a lot of implementation research to come up with the local solutions. See, we cannot just go with what is happening in Denmark or Sweden. They are very small countries with very high resources. They don't have any other social problems. Everybody is fully protected. We are in a very different social structure here. So this sort of collaboration between academic institutions like MAHE, civil society organizations and people with lived experience can actually bring up solutions which are fit for India for today. I think CanKids and the NGOs are doing a very good job, but the need is also quite demanding. So I think we need much more of the same to be done with more of collaboration. I would urge all the state governments and tertiary hospitals and other hospitals to partner with cancer care NGOs so that their burden will also be less. Patients will have much better support systems and there will be meaningful engagement of the society in the program. Thank you.